my name's Emily. I am a Macmillan Haematology Physiotherapist working at Hampshire Hospitals. The role of a Haematology Physiotherapist is to support patients who have been diagnosed with blood cancer, or they may have a non-cancerous haematological disorder. For the majority of my patients, they will have had some inpatient chemotherapy and they might have complications from that diagnosis of that cancer, so things like spinal cord compression. And so quite a few of my patients, it's actually rehabbing them and teaching them to be able to walk again. And so it's working from them being in the bed, getting them back up on their feet, getting them walking again, getting them home, and then progressing that rehabilitation in the home environment so that they are back able to do all of the things that they did before. So I had a patient who went home in a wheelchair, walking with a Zimmer frame and not able to do the stairs, and I saw him right through to getting back to driving again. A typical day or week for me will consist of seeing patients on the ward. So I'll be supporting ward patients with mobility, rehab, sometimes prehab. So if they're going for a stem cell transplant, I might be helping them with exercise before that. It would also include outpatients, and so I have various outpatients dotted through the day who are coming in to see me, who I'm supporting with physical activity and exercise. I also run exercise classes, so a couple of times a week I'll be running an exercise class with those same groups of patients. I became a physiotherapist in oncology over a number of years. So I always wanted to be a nurse, and I got quite good GCSE results and was encouraged by someone, why don't you try to be a doctor instead? I didn't want to be a doctor because I didn't want to do all that training, and someone mentioned physiotherapy. So I went straight from A-levels to a physio degree. I have worked at Hampshire Hospitals for my whole career, which is sometimes good and sometimes bad, and worked in lots of different areas, and had the opportunity to do a Macmillan post for 3 years and just fell in love with oncology physio and haematology physio. Went into management for a bit and did about 6 years in management, and then when I came out of management and wanted to go back to clinical, I knew the clinical area that I wanted to work in, and that was haematology. The part of cancer care that I enjoy the most is, for a physiotherapist, it's really broad in terms of the different things that you get to do. So I don't have to specialise in just one area of physiotherapy. I get to do outpatient work, and so musculoskeletal work. I get to do ward work. I get to do some respiratory work. I get to do prehab and rehab. So it encompasses all of the different areas of physiotherapy, but with a group of patients who are facing some really difficult times in their lives, and therefore there is a massive amount of job satisfaction. I think some of my proudest moments are working with patients who have been really debilitated. So they are wheelchair bound or really poor mobility, or can't do the stairs, can't drive, but are still young, and they've been treated from their cancer and they're in remission, but actually they're nowhere near what they were like before. I'm working with those patients to get them back home, back walking, sometimes walking with no aids, back to driving, back to work. That's the biggest achievement and the proudest things.